And we're live.
All right. Hey, good evening, everybody. We are West Coast time, so PST. And so it's 5 o'clock here. Potentially maybe a different time zone from where you're at. Excited to have everybody on. Excited to finally get the group of panelists on together. Med school students and aspiring med school students. And but just super excited to have a forum to talk about what it takes and what it looks like to apply to med school, to be admitted, and that entire journey. So excited for you to have everybody on. If you don't mind, go ahead and go on to the chat and let me open up that for myself as well. Go on to the chat. Where is the chat? Oh, there it is. Okay. Go on to the chat and would love to hear where you are calling in from. So go ahead and go on and maybe Anthony can get us started. But just list off the city, where you're calling in from. Would love to hear and see where everybody's at. Oh, my friend Eric in Santa Clara. Good to have you at Duluth, Minnesota. Awesome. Love it. I think our Sam and Ivan, where are you at currently?
Yeah, we're in Milpitas, California right now.
Milpitas,
Yeah.
sunny Milpitas, California, fantastic. And then
Yeah.
and William, where are you at?
I'm currently in San Diego, sunny San
All right,
Diego.
San Diego. Okay, so far we have a lot of West Coast, a little bit of Minnesota, Cupertino, Houston, Texas, fantastic. Dublin, East Bay, love it, love it. We've always had quite an array of people from all over the US and occasionally from all over the world. So excited to have everybody on and good to have everybody from all over the US. Today's topic is going to be really about med school and what high school students should be thinking about as they prepare uh, to be med school applicants. And again, the reality here is that for most high school students, you're going into undergrad and you still have some time to really prepare and think about how and where you want to apply to med school. So there is some time, but I love that we're having an opportunity to have this discussion early. Maybe to share a couple of just interesting data points that I found recently is that since 2020, since the start of the pandemic, there's been a 35% increase in applicants to many of the top med schools across the United States, but an 18% increase in total applicants. So there's been an increase in interest and awareness. I think there's somebody who's calling it the Dr. Fauci effect, right? With regards to students' interest in pursuing a medical career. Admit rates, I don't think there's any surprise to this, but admit rates to the top medical schools, including Harvard, Stanford, University of Pennsylvania, have all hovered around 1 to 2.5%. Super difficult to gain admission. And also, what I found interesting is that most recently, there is 52% of applicants were female, and 53% of admitted students were female. So, which is interesting, and there's been notation of that flipping from 10 plus years ago. So it's kind of interesting that there's been the shift, and that shift is also exists in the undergraduate application process as well. So maybe if you're a guy, it might be a good thing in this process, right? So let's go, William. Yeah. So with that being said, I'm super excited to have William Kerr, Ivan Chan, and Samantha Castro Rico joining us today. I'm going to give them an opportunity to introduce themselves, but I just want to maybe quick thing. William and I have known each other for a long time. Been a big fan of William, so I'm excited to have him on and to share his journey. And but excited for all three of them to come on and really share their stories. So as we get started, before we kind of dig into some of the nuts and bolts of medical school, applying, make college majors, undergrads, all that kind of stuff, Would you take a moment, introduce yourself, where you're from, where you're currently attending med school, or if where you're currently maybe applying, where you're aiming to apply, and maybe some of your interests and background. So if you don't mind, take the opportunity. Why don't we start with Ivan?
Cool. Yeah. My name is Ivan. I'm from Milpitas, California. Attended Milpitas High School and then eventually Yale. And currently I'm going to I'm going into my second year of medical school at the University of Pennsylvania, Perelman School of Medicine. Um, just I think as I've gone through college, I've kind of gone really interested in health equity, in just doing a lot of community health efforts. And so currently my specialty of interest is leaning towards primary care, leaning towards family medicine. But I think there's still a lot of exploring to do, especially as this year we're going into clinical rotations. And so trying to keep an open mind, and we'll see where things go. Yeah.
Yeah, similarly to Ivan, my name is Samantha. I'm also a second-year medical student. I am at the Pritzker School of Medicine, so the University of Chicago. I'm also originally from Chicago, so it's nice to be back home. I graduated from Yale with Ivan, and then I think right now I'm considering primary care as well. I like family medicine, but I also like obstetrics. So with family medicine, you can do additional fellowships where you can expand sort of the knowledge that in the kind of sphere of practice that you have. And so considering that, and I think it feeds into my interest with community-based healthcare. So excited to talk about all of that.
And then lastly, for me, fun fact, I've known Ivan for a long time, and kind of how we're all together is that I played tennis with Ivan in high school, and we've kept in contact ever since. And going down the similar path, it's really been helpful to have older mentors through me. So a little bit about me: I'm also from Milpitas, and then I stayed in California, went to UCSD, and then currently I'm applying, and I'm also working full time in San Diego. I kind of stay down here, and I'm working in a federally qualified health center with we're supporting low income prenatal patients. And my current
Absolutely.
interests, and sorry to add,
Oh,
my current
please.
interests are also like Ivan and Sam, family medicine. I think there's a wide scope of practice, and there's a lot you can do, and also maybe surgery, but there's so much time to figure that out. So that's where I'm at now.
Awesome. Thank you guys so much. And maybe a quick note to those of you who are attending. If you have questions, go ahead and post them in the Q&A box. And Anthony, if you've been a part of our webinar series, Anthony will jump back on and we'll field all the questions at the end. But go ahead and post them there. But yeah, thank you, William, Ivan, and Sam, for sharing a little bit more. Maybe it's a little bit of an intro, but want to maybe just dig in a little bit of your story. I mean, certainly I've worked with a lot of students for a lot of years, and I've had a lot of students tell me that they want to go to med school.
Yeah.
And the percentage of students who end up making it or who follow through on even the up until the journey to apply is fairly low. So let me ask you, what inspired you to pursue a career in medicine? Like, when did you decide this was the right path for you? And maybe a little bit of your story of how you got here.
Yeah. That's
So, and I'll open up to any of the three. Go ahead and jump in whenever you're ready. So,
Do you want to go?
Yeah, I can start. So I growing up, my family's from Mexico, and we moved to the US when I was about 6. And throughout that big transition period, my parents didn't have a lot of access to constant or consistent healthcare. Often I was the person that would interpret for them during medical visits and had to manage insurance and payment and finding doctors and specialists, things like that. And when I was pretty young, my dad had a very negative experience with the healthcare system. And so I always felt very distrustful of it. But as I grew older, I went through high school, I started to be more interested in the role that I could play within healthcare to improve the care that patients like my parents received. And so I went through college. I was a volunteer for a free clinic that Yale has, where we serve predominantly Spanish-speaking patients, similar to my parents, that were uninsured. And I think really cemented this idea of what healthcare could mean and the role that I could play. And so continue to explore that in addition to my coursework and a lot of social justice-based work, where I felt that healthcare was a good area where I could treat physical ailments, but at the same time treat a lot of social vulnerabilities that my family has had to go through, but also a lot of the communities that I hope to serve in the future. And so I'm hoping to continue doing that in primary care and as I go through medical school. But I think ultimately my family and their experience with the US healthcare system and its inequities has really driven me to see a path in medicine.
Awesome. Thank you, Sam.
Yeah, no, that's really great. Yeah. I think it's interesting because I feel like for me, I didn't really have a clear image of whether I wanted to do medicine, even up until probably my sophomore year of college. I think there were a lot of things. I feel like when you're young, it's a really big investment to make because you have to think, 8, 10 years in the future, like this is what I want to do, and like you have to set yourself up in order to get there. And sometimes it can feel like it's a really big investment or like a really big plan in order to have that very concrete future. And so for me, I feel like I've spent a lot of time throughout college kind of exploring these different paths that I wanted to take. Similar to Sam, I also had some family experiences with the healthcare system that like kind of well, my family relies more on traditional medicine. My family's pretty Chinese, and so they're very like traditional medicine oriented, and so we don't really go to the doctors too often. Like when I'd get sick when I was in elementary school, middle school, high school, most of the time, like if it wasn't anything like an emergency, you wouldn't go to the doctors. So it wasn't really something that I knew that I wanted to do for sure, like in my first couple of years of college. And actually I ended up exploring a couple of things. I did an internship in teaching. So I was teaching for quite a while. And it was actually something that I did during my gap year also because I really enjoyed it. Outside of teaching, I did research in public health. And so and then I also kind of explored doing like statistics and data analytics, but ultimately like similar to Sam, like working in a very clinic volunteering environment and working with these patients, listening to their stories and really connecting with the patients on a deeper level, it made me realize that, oh, there are so many different things that I could do, but this is something that I felt like I really enjoyed doing and wouldn't mind doing for the rest of my life. And it was something that I felt like, you are contributing very directly to the well-being of a community, to the well-being of the patients that you see. Which of course, there are a lot of different careers that you can provide service, but this is something, especially if you're interested in the science, if you're interested in like medicine as an idea, and connecting that with the very human experience of treating patients. I think it's a really great career to kind of explore, and so yeah, that's kind of how it just kind of came together. It's a lot of mumble, like a lot of kind of like jumbled ideas, kind of like hopping along different paths, but then ultimately like coming to an idea that, oh, I really wouldn't regret doing this in the future. And so, yeah.
Awesome. Thanks, Ivan. And I just want to make a quick observation before I give William, but like an observation of you actually took time to explore other disciplines, other career fields potentially, and other things that you might be good at. And there was sort of a sense of exploration built into your process. And it wasn't just you decided one direction and you went for it. So that's interesting. Yeah, William.
Yeah, so I think more similar to Sam, I kind of was not maybe more you can call it the diehard pre-med, kind of knowing that I was exposed to it probably in high school. My dad works in biotech and he always wanted to go to medical school, but he didn't have the grades. And by the time he was thinking about a post-bac, which is what most non-traditional students do, he had me. And so he wanted to be financially stable. So I feel like medicine has kind of been around, you know, I was kind of spoon fed it, and I realized in college as I started, you know, volunteering, and even in high school actually is where it started, through Elton's recommendation. I did a program at USC, and as a high school student, there's not as much you can really do. It's more of observation and getting exposure. And so seeing how doctors interacted, I realized that it really was like, you know, science, and like what Ivan said too, there's this humanistic component. And, you know, doctors, and I work with, you know, Ivan, Sam, and I, we see doctors all the time, and there's just a lot more responsibility, and that was something that I really saw. Like, I don't want to just be, you know, a technician. I also want to be able to help them with other, you know, issues that arise that are related to their health, but may not be exactly seen in a lab test. And so that's kind of what made me fascinated with medicine. And being in San Diego, I think I was fortunate to have a lot of opportunities working close to the border. You know, we're only 30 minutes away, and so I got to, you know, work in Tijuana as a volunteer coordinator, and work with refugees from all over the world, from recently Ukraine to South America to Haiti. And so, you know, being someone that's just fascinated and addicted to Google Maps and learning, you know, about people, I think medicine is, you learn about people, is a very generic, you know, phrase that, oh, you love people, but it's really the heart of, I think, this field. And it's driven me to continue this path and, you know, work through pretty much all the barriers that exist in becoming a doctor. But I think that people that kind of prevail through are the ones that end up, you know, loving the field and embracing those responsibilities.
Awesome. Thank you, William. Appreciate that. Let's get right into some questions as it relates to the high school journey. And so this is where and then there's already a host of questions coming in, and then there's some questions that we've already planned, so which is great. But what advice do you have for high school students selecting undergraduate programs and majors? And this is where you can certainly think about your own journey, right? And you can certainly think, if I had to do it over again, what would I do, right? And so, especially thinking through the application process, your own experience, like, what should high school students be thinking about as it relates to where they go to school, what they should study? What are your thoughts?
I can start. I think so. I majored in political science when I was in college, which had nothing to do with medicine. A lot of friends that
Yeah.
I like knew did bio or chem, which is a great major to have. I think for me, I really loved the like political science-based classes that I took in high school, and I thought they would be interesting. And I think looking back over like this long application process, I'm really glad that I went to a school that was a liberal arts institution where I was exposed to a really big array of the social sciences. I'm going to pursue a career in medicine, and so all of these things centered on bio and chem, like physiology, I will learn those anyway. And so to me, my rationale for majoring in political sciences, this is really the only opportunity that I'll have to invest in another kind of passion area for me. And I think it made me a much better writer. It made me a much better critical thinker, which has fed into all areas of my path afterwards. When I was applying to medical school, when I was studying for the MCAT, all of these things I think contributed. And I'm really grateful that I, had the affirmation from different mentors that it was okay to major in a non-STEM kind of field, because there was a lot of pressure to be bio or chem or physics. And I didn't think that I would necessarily like be as invested in those things at that point in my like academic journey. I wanted to take classes on the politics of like literally anything, and like race and thinking about ethnicity studies, all these things that contribute to medicine, but are maybe not as directly kind of connected within like a physiology class that you're going to take. And so I would strongly be biased for that. And like having that opportunity to go to an institution that offers those classes.
I'm gonna give Ivan and William an opportunity to respond, but just to follow up, Sam, with what I think you already just probably broke a misnomer about what is needed in undergrad. Certainly, I just had a conversation with a family I mean, the assumption is that you need to study biology or some type of life science in undergrad in order to be best prepared for to being an applicant in med school. And you kind of obviously, I think, just broke it. Number one, I think you already made some comments about the benefit of actually studying the humanities in preparation for med school. Do you have a sense of whether does studying, I mean, generally speaking, does studying a major that's outside of STEM either help or hurt in the admission process?
I think it helps. At least for me, it did. It gave me a lot of different things to talk about during my interviews. When I was writing secondaries, I think if I had been more accustomed to like scientific writing, for example, things that you would learn if you're doing a lot of research and like focusing on that area, I don't think I would have been able to speak more like a narrative way and have like a type of writing that was interesting for people that are reading like about like your own life story. I think sometimes it's hard to translate those skills over and to learn them immediately when you're doing it. Only every once in a while rather than within every class that you're taking when you're practicing constantly. I think when I was doing interviews, it was always a question that I was asked, like, you didn't major in like biology, what was your favorite class then? Like, why was this helpful to you? And I had so many things to say, whereas I don't know if I would have felt as passionate about talking about my introductory chemistry class, right? But there's just so many different things and so many different interests that I pursued. My thesis, like all of these questions that I received, I had like a passion for answering them. And I think I just had more to say because they felt more applicable than something that was like molecular, that's more abstract or maybe related to medicine, but not so clearly. I think in terms of it hurting me, I think the only thing I would say is potentially studying for the MCAT, having something like the chem or physics sections, maybe someone that had spent more time in those areas and had gone into upper level courses would have felt more comfortable with studying, but I think it ultimately ended up being okay.
Yeah.
And I felt like I was more prepared for the car section, which is something that I think a lot of people often struggle with.
Yeah.
But that reading and those skills were very easily transferable into that exam.
And just to maybe isolate two things that I heard you say. Maybe number one is that it's studying in the humanities has helped you really maybe it's perhaps tell your story better and really learn what it means to sort of like think outside of a more kind of STEM analytical focused type way of thinking. And then also it allows you to sort of connect the dots on the issues that are happening around health. And in so doing, like really communicate effectively about not just what is happening in medical science, but the ramifications that medical science is having in the world. Fantastic. And sounds like it helped more than hurt. So that sounds like you did great. Ivan and William, anything else to add with regards to college majors and or undergraduate programs?
Yeah, I will say that I think, going back to your the common misunderstanding of like, oh, you have to major in bio, major in chem, or something in life science. Like ultimately, everybody who is applying to medical school will have to take the same prerequisite classes. And so ultimately, no matter what you major in, I mean, Sam majored in political science, but she took all of the biology classes, chemistry classes, physics classes that were required to apply to medical school. And so I think, to be honest, I think like these classes already prepare you enough to take the MCAT. You don't need higher levels of knowledge in order to excel at this exam. And so I think with that in mind, it gives, for me at least, it gave me a little bit less pressure to worry about taking like advanced biology or advanced chemistry, physics classes. For me, I did have a very strong interest in the life sciences. I didn't major in biology, but I majored in neuroscience. But my focus was very outside. It wasn't very like biological neuroscience. What I did was more computational and social neuroscience. And so it was really interesting. It wasn't necessarily like specifically tied to learning about biological systems, but I felt like it was, I think honestly, like as long as you find something that you're really interested in, and it doesn't matter what it is, if like, you just do the major, and as long as you do the prerequisites, you're going to be fine. Yeah.
Yeah, and then just to add on real quick, I think for me, if you asked if we had any regrets, I probably would have studied history instead of microbiology because like Ivan said, you take a lot of these very specific like microbial genetics, right? And if you have a passion for that, great. But for me, I realized that I wanted to just take these prerequisites and really, explore. And one of my favorite classes at UCSD was like imperialism in the Pacific. And so like these sort of classes, I was like, wow, I should have done history. My best friend's dad, who's a physician, studied history in college. And so I think that you should study. I think it shouldn't be like, what are the advantages? What are the disadvantages? It should really just, you should study what you're passionate about. If you love data science, I'm sure you can find ways to connect data science into medicine and, create your own programs to help, low-income clinics improve their medical system, patient information system. So I think that there's a lot to choose from, but I would have done history, and I'm really jealous that Sam did political science because it seemed like and she had a great time. And I even love neuroscience. So it's just I think you just have
Yeah,
to pick what you're passionate about.
yeah, and I
And
think. Oh, sorry.
no,
I just wanted to say, like, I think there's also a very big difference that I didn't realize until I was actually in college in terms of the different types of college and universities that you can attend. The University of California system is a fantastic school system. But I think one of the things that you can consider when you're applying to college, because I think that's like, the closer step, right, to for a bunch of our audience, is thinking about the difference that Sam mentioned about liberal arts schools versus non-liberal arts schools. Because for me, I felt like so just to give an idea of like the number of classes that we have to take for our majors, I think it's somewhere between 12 and 14 classes. And so that's 12 and 14 out of 36 to graduate. And so outside of the neuroscience classes that I've taken, I was also able to take some really, really interesting classes on political science, on history, like all these social studies courses that I felt like were really that really helped me kind of broaden my perspective. But on the other hand, for example, like somebody who goes to a state school, like Will at UCSD, you are a lot more limited in the classes that you can take out because you have so many more classes that are required to complete the major. I'm sure you could talk a little bit more about your experience, Will, but from what I understand, you only have like, maybe 3 or 4 classes that you can take outside of your major, right?
Yeah, that's true. That's a good point to mention. So liberal arts, you have more flexibility. So I think with the UCs, then it matters even more that what you study because you are limited. Besides your general education classes, it's all upper division, pre-med, I mean, genetics, whatever biology classes you have.
Right.
and I think maybe two things to maybe pull out from what you all shared here is that I think maybe Ivan and Sam, I think you're kind of sort of valuing the liberal arts approach to education, which is creating space for you to really explore. And there's a little bit of where I sense that you're putting a premium and perhaps a justifiable premium on really having, really enjoying your undergraduate experience and having space to explore your curiosities and to really veer outside of biology. And the assumption here is that that's not a net negative to your journey towards med school, towards being a doctor, and that invariably I think there may be some assumptions or misconceptions that really the best place to prepare for med school is our schools like a UC San Diego or UCLA, which do from the numbers generate a ton of med school students. Like there are a ton of students from both schools that go to med school every single year. And there is a university hospital that perhaps undergraduates have access to, and that seems like a very logical and mindful way to prepare. But you're saying, which I would agree, that that the liberal arts liberal arts college experience is also a very viable and worthwhile path as well. Is that correct?
Yeah, yeah, that's absolutely correct. And I mean, you talk about numbers, but like these schools also have plenty of students. You
Yeah.
have 30,000 students at at some of these state schools. And I mean, like at a liberal arts school, generally, like you might have I don't know, like 10,000 students, like a third or maybe even less, right? And I think, I don't know, like I feel like you are just a more well-rounded applicant. And in terms of experiences, I feel like Sam said, you know, you could talk a little bit more during your interviews. And also um with I feel like with the liberal arts experience, I felt like, for me at least, like I talked about earlier, like I didn't feel like I was limited in my path in terms of, oh, like for example, if I went to a state school like UC San Diego and I decided to, oh, I want to do the pre-med track, it would be really hard for me to switch career paths, right? Like let's say I was, you know, 2 years in and I decided, oh, you know, this isn't really something that I feel like maybe there's something else that I would enjoy more. Like it would be really hard for me to make that change. But with the education that I had, I felt like there were a lot of avenues that I could take. And like I mentioned, you know, I did explore these other career paths that I really wanted to explore, and but ultimately came back to medicine, but I had that space to do that. Which I feel like, you know, you're only going to do college once, right? And so this is something that is important to keep in mind. But at the same time, I feel like also something else important to keep in mind is also the finances aspect. Because for a lot of people, you know, attending a public university is less expensive, just financially, compared to attending like a liberal arts private university. And with this, and it's important to keep that in mind, especially, you know, if you're going down this path, because the majority of students in medical school take out loans to pay for medical school. And so to reduce that loan debt, it might be a smart financial decision to attend a public university. And so, you know, there's pros and cons, and I think it's really important to weigh both, and consider, you know, what you feel like would be the more fulfilling, more intelligent decision to make for yourself when you get to that point.
I appreciate the pros and cons for both, and I think perhaps the tenor really is that it's absolutely not a liability to go to a liberal arts college.
No.
I think maybe just a follow-up question. Do you think there are some maybe measurable benefits to going to a liberal arts college, maybe as it relates to letters of recommendations for med school, or the accessibility to internships, perhaps research internships as well? So, are there some benefits to going to, like, say, a smaller private school, or a smaller school and a small liberal arts college in general that may be more beneficial to the med school applicant process?
Yeah, that's actually a really wonderful question. I feel like in general, the student to professor ratio is a pretty important thing that people don't consider enough. Because I felt like throughout my liberal arts college experience, you know, I had numerous opportunities to really get to know certain professors because like the class sizes were so small. Like we had mostly seminar style classes. So you'd have maybe 5 to 10 students in each class. And so, you know, you really get to build that sort of connection with a professor that you might not have as many opportunities to do so in a state school or in a public school. And outside of that, I feel like research is that's also an important thing. I think generally with more students, things get a little bit more competitive in terms of, you know, how many open positions there are, like how many you know, like whether you're able to pursue certain things. Um, I felt like I was able to have a pretty large role in exploring. When I was doing research, like I had very one-on-one mentorship within my lab, and I was able to, you know, play a really large role in terms of the projects that I was a part of, which might not necessarily be the case depending on where you go and depending on you know, what positions are available to you at a state school. But that was a really great question. I think, you know, it's something else to keep in mind also. Yeah.
And maybe for William on the public school side, certainly this is
Yeah.
this is not a poo-poo on the large public
Right.
public school.
Yeah, no,
Well,
but
why are
I
you at
agree.
UC San Diego?
Yeah, I
But like,
agree. Yeah, I agree. And the letter of Rex, and these are things that, as high school, in high school, I don't think Sam, Ivan, and I were thinking about how the school we picked would affect letter of Rex. And, because this is something that you do during the application process. And at UCSD, I was able to get good letter of Rex, but the professors, I had to really reach out. I had to find them. There's a lot more, you're competing, they're classmates trying to also speak to them. And so, I got letters of Rex from professors that I took multiple class with, or I had a very small seminar session. I really got to like build a relationship with them through office hours. So it is possible, but with a larger class size, it's inevitable that you're going to be, in line with other pre-med students trying to talk to professors. So that's something to keep track of. Pros and cons. The good thing about UCSD is a big campus. There are a lot of research opportunities. There are also a lot of students. So there are definitely trade-offs there.
So what you're saying, William, is that like, I mean, more students, but also generally speaking, a lot of opportunities. There's a lot of things.
There are a lot of
Yeah.
opportunities, and also, liberal arts schools, maybe not Yale in where it's located in New Haven, but maybe something that's more remote. I think that it may be harder to work with diverse populations. And being in San Diego, I think really shaped my personal statement, my journey into medicine. And so location is key because those opportunities are really going to impact your application, more so than the grades.
And maybe just to finish up this sort of like a question about undergrad or maybe choosing undergrad, certainly all of you are going to very selective universities or went to selective universities, going to selective universities. But like selectivity is a part of it. But if there was like, what elements in an undergrad should a high school student be looking for? Because I think this is where I think you're saying that liberal arts colleges, fantastic, good opportunities. There's opportunities. Large public schools, there are certainly plenty of opportunities. But if I'm trying to maybe reduce my school list down from 1 million colleges to less than that, what are really the key things I should be looking for in an undergraduate program that would make it a good fit for a pre-med aiming student?
I think for me, one of the big things was recognizing that college was going to be hard and that I would probably struggle through many parts of it. And so I wanted to make sure that I had a really strong community while at the school. And so for me, as like a Mexican American, I really looked at location. Like if I go to a grocery store near my school, will I find food that I will want to eat? And I think it's a small thing, but having communities where you feel integrated and accepted is a really important part of building a support system wherever you go, both for college and for medical school. And so thinking about location was really important to me. And I think that sense of community, or looking for that sense of community, spread to other aspects of a university. Like, are there clubs that I see myself joining? Like when I look at like let's say like a page for student affairs, does the class look like me? Like, could I see myself in these spaces and see myself succeeding in these spaces? And I think I was very intentional about asking myself that question. And if the answer was no, I didn't apply. Because I didn't think that I would be successful there. And I think it has led me to be in spaces where I do feel supported, and has made the really low parts of college, which will come at any point, be a little bit more bearable. And so that would be like a big thing. Also financial aid, like which schools are able to offer more support, whether that's need-based or merit-based, to make sure that like the burden of a college education, when I'm thinking about medical school, which is going to be another big 4-year expense, is not as kind of expansive. And I think sometimes with private institutions, like if you are an out-of-state resident, they might have more of an endowment where they can give like need-based aid or merit-based aid. Whereas similarly, if you are going to an in-state public institution, you will also have a diminished tuition. And so keeping those things in mind and balancing those priorities.
Yeah. But ultimately, like in terms of applying to medical school, outside of considering, I think, all the things that we've already talked about are really valid things to consider in terms of opportunities, in terms of support. But outside of this, really you know, if you had two applicants with the exact same, you know, resumes and one who went to like a really really selective college and one who went to, you know, a much less selective, perhaps like a public university, um, it doesn't really matter to like the medical school admissions. I have a lot of, I mean, we both attend pretty selective medical schools. And in my class at Perlman, you know, we have a lot of students who went to really tiny public state schools, you know, like in the middle of nowhere, Mississippi, Michigan, uh, and like they you know, they're still they're my classmate, you know, like these are students who, you know, because they weren't, there's no limits on I guess like, you know, the selectivity of the college that you go to doesn't really matter as much as you might expect it to, but rather it's this idea of like whether or not you're able to really take advantage of the opportunities that you were given, or the opportunities that you know, are available to you within the space that you do eventually go to. Uh, yeah.
I think you also pointed out probably a big misconception probably from the audience too, is that I think they're probably thinking, hey, you both went to Yale,
Yeah.
and invariably you're going to get admitted to whatever med school you're going to apply to, which I think you would both agree that that's far from the truth, right? You know, and but certainly what I hear you saying is that like where you went to undergrad does not factor nearly quite as much as everybody thinks
No.
in the review process, as we all think, right? And so what I heard you saying is that, you know, there's certainly some students from top schools, but there are other students from small, you know, perhaps small public schools in more rural and different parts of the United States, all ranges of selectivity, some not selective and some very selective. And and it does harken back to me to where I remember reading a Stanford Med School promo that was also very proud of students coming from, yeah, all types of universities, including small public schools from the South, from the North, including Ivy Leagues as well. And so what I hear you saying is that like the selectivity of school, because I know there's going to be a lot of parents who are thinking, hey, if my kid just gets into UC Berkeley, they are absolutely, you know, like, you know,
Right.
they're going to have a better chance.
Mhm.
And you're saying that that's not really quite the case. And
No.
so, and what I hear you, at least hear you both highlighting, is that it's really the learning experience, finding the right community. You did mention that it was helpful to have smaller classes to have better relationships with professors to, you know, therein perhaps provide better letters of recommendations, access to research, et cetera. So all those things mattered, but it had less to do with just trying to get into the highest ranked thing, as you can
Absolutely.
imagine, right? So,
Yeah.
okay.
That was a
Yeah.
great way to phrase it, Elton. Yeah.
William, anything else you want to add? And perhaps maybe this is your pitch for public school, large public schools.
No, I mean, I think I remember I was debating between like a smaller private school with some scholarship in Florida and then UCSD, and I ultimately picked UCSD because I thought, you know, I was looking at it was a numbers game for me, and also, you know, being in San Diego, I was like, I really like the location, and I think there's so many things you have to factor in, but I think to just like get rid of that myth, like prestige really matters less, like unless you're applying to like Goldman Sachs or investment banking, then but in the field of medicine, they care a lot more about your experiences and you know how what you've taken, the opportunities you've taken. So I think at UCSD, the biggest if I were to sell UCSD, right, as a pre-med institution, I would say that the geographical location gives you immense opportunity with the biotech up north, down south. You can really get involved in street clinic. And so, you know, the location is perfect for medicine. You know, being at the confluence of the US and Mexican border, there's a lot going on. And so I would say for me, location probably was the biggest factor in making UCSD an attractive option for me. And now I realize that now, and initially it was more just like, oh, it's a big public school that pumps out a lot of medical students. So I think UCSD is great for its location. There are trade-offs, and you know, I wouldn't trade, you know, I would still love, if I were to go back, I would still do UCSD again. And so it's really what you make of the experiences. We've all had really good experiences at different universities. So
Awesome. Thank you, William. That's a good pitch for UC San Diego.
Yeah.
I want to actually make sure that we have enough time for questions, and there's a couple questions that I think I'll save those for the Q&A, and so I don't want to, maybe one or one and a half last questions left. What do you think? Like, you're applying. You applied and are admitted, and you're applying. You're in the last sort of, you know, you're either in or you're in the last stage. But what do you think were the most commonly misunderstood aspects of applying to med school? Like, you kind of had an idea back when you were in high school. Maybe you had an idea of what it would be like somewhere along in undergrad. But now that you're in, or now that you're applying, what were some of the most commonly misunderstood aspects?
I can start. I think when I started college and kind of cemented my understanding of what what I needed to do in order to get into medical school, and actually even through some of the end of my high school, I received a lot of messaging about like, you need to do this, like A, B, C, D, like constant like braiding of like, you have to have this many hours and this many extracurriculars, and you need to be involved in A thing and B thing, and you need to publish like 10 papers, and it was really overwhelming. I didn't
10 papers.
It
Yikes.
was a ridiculous amount, and I think a lot of the like rhetoric that I was exposed to, and it made medicine feel very inaccessible.
Yeah.
And I think one thing that has been really helpful for me in recognizing, and it took me a few years in college to get to that point, was that if I invested more time into fewer things that I really cared about, I would have a much more meaningful experience. I would grow so much more as an individual. And although maybe I couldn't fill out the 15 activities that they ask of you in the medical school application, I had really amazing experiences to fill in 10, and those 10 were sufficient. And so I think quality over quantity every single time. I think if I had received that messaging, I would have, had another year of investing in something that I was really passionate about, and I would have grown even more than what I could have done in the 2 years where I kind of internalized that message and tried to act on it. And so maybe keeping those things in mind, I think it's overwhelming to receive that, but important to ground yourself in what is actually important to you and what are you actually doing in order to like fit a mold. Right. I think the mold is non-existent. And so just trying to feed into your passions is more important.
More time, fewer things. No need for 10 published papers. Okay.
Exactly.
Exactly.
I didn't have a single one.
I know, zero.
Yeah. I mean, certainly there are going to be some students who, are really into that research aspect, right? And that could be one of those things that they feel like, okay, this is something that I really want to commit to. But ultimately, I feel like for medical school, and I think in general college too, I think just really focusing on certain things that you are really interested in and really developing a deeper understanding for that passion rather than kind of spreading yourself out really thin, trying to do everything everywhere all at once, right? It's yeah, that's really the opposite of what you should be trying to do. Because it's always so much more interesting to to talk to a person who has like this really specific niche that they've been spending a lot of time in, and like it's something that they're really passionate about, rather than just talk to somebody who's who has a surface level involvement in a bunch of different things but can't really talk specifically about something that they really committed a lot of their time to. And so I think it's just something that you'll like, just like a life lesson really in general, but it's really helpful when you get to that stage of the interviews, and people are going to ask you like, what do you like to do, like what are you passionate about? And if you can't answer that question, then maybe that's something that you need to reconsider.
And you shouldn't talk about chemistry in that.
Right.
I really enjoy chemistry, specifically intro chemistry.
Yeah.
um, yeah. William, anything you want to add here?
Yeah, no, just reiterating longitudinal commitment. I think that's something, as I'm
Mhm.
kind of, sending off these essays, it really helps kind of complete your story. And the top med school admissions officers always mention that, like, are you saying, is it backed up by what you did? Because it's very easy to write something that sounds really nice and answers the prompt of what these med schools are asking for. But I notice myself that when I'm able to answer a prompt well, I'm able to reference back to something that I did. And so having that sort of, so I think, like, as high school students, like, just think about what you're like really passionate about. Like, if you like learning like languages, and you already, like, for example, like Sam spoke Spanish, like you could do medical interpreting, you could get certified. So you're not just like assisting in the clinic randomly, you're actually like, in the visits. Or if you're interested in, you love work, like you love visiting your grandparents in the nursing home, and geriatrics is really something you're passionate about, you can like get into hospice care and research. And so those are things that you can think about, because medicine isn't generic. There's so many different paths you can pick from. And so, for me, it was really interested in global health and like working with like refugees. And, in San Diego, I had those opportunities. So I learned Spanish here in San Diego, and that was sort of some passion that I developed. So think about, really, I think, for these students and, all these parents that are trying to support their, like, just really ask them, like, what part of medicine are you interested in? I know it's a very young age to be thinking about that, but I think giving that thought process will shape, what the organizations you pick in college and all of that. So, yeah.
Yeah.
Awesome. I feel like we could talk for like another hour, but I want to open up for some questions, and I want to bring in Anthony. So, Anthony, if you can jump in with us, and what do we got? What do we got on deck?
Yeah, I'll come back. I had a question here around how athletes prepared during medical school, and kind of, I think, but in general, I think it's mostly talking about your ability to like balance your time commitments and things like that. Could you guys speak on kind of how that worked out for you?
Yeah. Well, none of us are student athletes, but we've had friends who were, and I mean, generally it's a pretty favorable thing when you're applying to medical school, because these med school committees understand that it's a very strict time commitment, and that's something that you are really spending a lot of time in. And same with, like, if you're working a work study job, right? Like where you're spending 10, maybe 20 hours a week, dedicating your time to a specific activity. But with generally, I think one of the best ways that you can really try to manage this is having a very regular schedule, having routines, making sure that outside of the time that you have blocked for, for athletics, or blocked for, your work, you are using that time productively. I think ultimately with admissions, athletes are generally seen like they how do I explain it? Admissions officers, they kind of understand that okay, you are spending 10, maybe 20 hours preparing or like in competition, and so it makes sense that you have a few less hours in like research, or a few less hours doing service, because you have different commitments than other people generally would. And so you do get a little bit of leeway there, but it doesn't mean that you can just not do any of these other things also. It's a lot about making sure that you have that schedule, so that you could fulfill those responsibilities. And it's about being organized, and learning how to manage time effectively.
Yeah, I also was not, like Ivan said, I was not a student athlete, but I have a lot of classmates now that were. There's actually a really cool organization that they formed called Sneakers to Scrubs, which is there are a lot of like students in my class year that were either professional basketball players, or they like played within the
In the
college level.
NBA.
Yeah, in the NBA. And so
Who?
Right?
That's another podcast. Yeah.
Yeah. It's very random, and them, like they're very successful, and they're much older than most of us. But I think they've always integrated medicine within the sport that they were in. So in this case, they were all basketball players, and so they've like made sure that they like work within communities and with kids that played basketball and introducing them to medicine, and that being kind of a pathway to like a career in medicine that maybe wasn't like available to them. So I think keeping that in mind, like all of the things that Ivan said about managing time, and like I think keeping track of all of those responsibilities, but also recognizing that like sports and these other extracurriculars are not exclusive, right? Like they go in
Right.
tandem with medicine, they go in tandem with everything. And so keeping that in mind.
I want you to send us a picture of Michael Jordan in the lab next
I
year.
wish I had that, but no.
Yeah.
Um, Anthony, why don't we do the extracurricular activities? I think that's
Sure. Yeah.
yeah.
There's a question around the extracurriculars for high school students if they're kind of interested or wanting to go towards this pre-med track. But just thinking about like, yeah, what would you recommend students work on at this point?
I guess I can start because I did a few medically related, like I said, in high school. I was kind of already thinking about it. So I did a program at USC that I really enjoyed. It was basically like a 2-month seminar based course. You get paired with a professor, and it was at USC, University of Southern California. So we got to explore the Children's Hospital Los Angeles, and we got to see kind of it was called Future Physician. So again, like I said, in high school, there's not a lot you can do. It's more exposure and kind of seeing what you like. Some high school students start with research. I know in my lab at UCSD, there were some kids from the local high school starting research, which is that's great. I mean, if you want to start research, then it's a good opportunity. And honestly, you forge a lot of connections with professors. And so, it could be something you're passionate about. But again, it's like, or hospital volunteering, they're at our hospital, they are very selective, but they did take high school. If you were in your senior year of high school, they took that. So I think those are some early things you can get started with.
Maybe real quick as a follow-up, like are any high school activities perhaps, I mean, by the time you're applying to med school, I mean, none of those things are essentially included on your resume, right? So I think perhaps the activities are as perhaps William, I think, is alluding to, is really about exposure, really about like seeing if the medical path is a good path for you. And so whether it is hospital volunteering or hospital exposure or shadowing or research. But yeah, anything else, any other extracurricular activities you would recommend for high school students?
I think
Bio Olympiad. Oh no.
maybe not for me, but shout out to those that would enjoy that. I think two things. I think high school is a time that maybe feels very overwhelming while you're in it, but really is probably the most free time you'll ever have as you go through like higher levels of education. And so I would strongly like encourage people to like invest in skills. So like if you speak a language or you're interested in a language, like really engaging with the classes that are offered at your high school, or like opportunities to like integrate like that language into your everyday life. So by the time that you are in college and you're maybe a little bit more busy, you had a better foundation to improve that language and get to fluency if that's something that you would want. Like,
Yeah.
I think both in terms of I mean, Ivan can talk about like a recent like Spanish like integration trip that he did, but I think just building those foundations and preparing yourself for like the skills and the type of doctor that you want to be is really important to do in high school. I also did like a global health program. It was pretty short. I think I wanted to see what like global health looked like. I think there's like very different perspectives. I think to some degree I feel very thankful that I did it because I was exposed to medicine where I wouldn't have been able to like closer to home. However, I think I should have been more selective about the program that I was in and the type of work that they were doing, the impact that it has in the community. All of these like considerations about like the impact of global health and the ethics of global health that I maybe learned when I was in college that I wish I would have thought about when I was in high school. But really like critically engaging with the programs that you want to be a part of and seeing all these different aspects of medicine would be my big suggestion.
Yeah. I think what Sam mentioned about, these like language is low-key a really important thing that I felt like I didn't have enough emphasis in when I was in high school. Because when I was in, college is when you can really first start to really get involved doing clinical volunteering activities. And sometimes it can be really helpful to have a fluency in a language that, a population, the population that you're treating really speaks. For example, Sam was actually a medical interpreter at the free clinic based out of the medical school, and this being able to speak Spanish with complete fluency really gave her an edge to do more, to have more responsibilities within the clinic that other people might not have had. But yeah, I mean, like, I wish I learned Spanish to a higher degree when I was in high school, or like paid more attention, because I started well, I realized how important it was when I started medical school, and that was when I started learning Spanish. And this past summer, the past 2 months actually, I was in Guatemala doing an immersion program, immersion medical Spanish program, where I was working in a clinic and also learning Spanish at the same time. But I feel like I would have achieved a greater degree of proficiency if I had started that sooner. And also, I feel like in high school, honestly, like we said about, just focusing on things that you're really interested in. For me, I spent a lot of time, I really enjoyed doing community service and like working with my friends to do that. And so we kind of set up a program with like the local elementary schools to get students involved with community service when I was in high school. And that was just something that was like a passion project that I really put a lot of my time into. And I didn't really do anything medical related, but I thought that it really showcased, something that I was really interested in, and it definitely helped with the college admissions part. But yeah, I think ultimately it goes back to that idea of, okay, like find something that you're really into and then really dive deep into it. It doesn't have to be medically related. It can be anything. And so, yeah.
It absolutely sounds like, actually, I think we're at the top of the hour, and I want to make sure we probably, I'm not sure if we have, I kind of want to like, but I feel like a lot of the tenor of what everybody is saying here is really like, you don't need to live and breathe biology and or anatomy, and that the value of really exploring in all directions, there's value to it. And I almost feel like you're saying that it's really critical that whether it is languages, whether it is the humanities, whether it is history, whatever it might be, to really take the opportunity to really go deeply into those areas that you're most curious. And it's not compromising your journey to med school. In fact, it is an asset. It is an informant of your journey to med school. I'm trying to think, Anthony, you have time? Yeah, you guys have one line about BSMD?
Yeah.
That's a loaded question.
One line, yeah.
I don't even want to. There's no question. This is BSMD. One response. One line response.
I think shout out to those that do it. I think for me, it's all very restrictive, and so I wouldn't have done it.
Right. Yeah, I know people who have gone accepted into it, and these BSMD programs, they're like, what you have to understand is it's a lot of work. And generally with medical school, like with the process that where you go traditionally, like just through college and then to medical school, you have like those courses a little bit more spaced out. With a BSMD program, it's very intense all the way through. And if you know that that's something that you want to do, you will save a lot of money and save a lot of time. That is a fact, but you have to be absolutely certain. And I feel like when you're 18, it's hard to be absolutely certain for the majority of people. But if you are that type of person, then I think it's a good track to pursue.
All right. William, I give you last word. Go for it.
I have friends too that I know a friend that did it. I wouldn't do it because like it's just too condensed, doesn't give you, and most of my friends changed are not pre-med. So just my 2 cents there. Yeah, I would. But for the few that are 110% medicine, then do it. Then do it, to be honest.
110% when you're
Right.
17 or 18. You got to be 110%.
Exactly.
It's true. That is what I also tell students and families as well. And your profile needs to match that. That's kind of the challenge in high school, is that you got to be there. Your profile needs to be there as well, and
Exactly.
it's difficult, right? And the dropout rate is fairly high
Yeah.
for BSMD programs. So another webinar podcast for another day. But Ivan, Sam, William, thank you guys so much. Really appreciate all the valuable input. I think we learned a lot today, and I think corrected a lot of misnomers, misconceptions about the med school path. And I just feel like maybe perhaps the point I feel like we should all take away is that there's room to explore, and it's not so restrictive, and it's not, there are ways to get to where you need to go, and sometimes it seems overwhelming, but there's room to certainly you need good grades, good test scores. You do need a resume, but there is room to really be who you are, and to really enjoy your undergraduate experience, really explore your intellectual curiosities. And so appreciate all three of you. And thank you for all the attendees. And we likely will post this video sometime soon. And next week is coming, I think, for Ivan, Sam, and William, care less, but we're doing a digital SAT webinar. And maybe Ivan and Sam will sign up quickly and want to learn about it. But digital SAT with our friends at Ivy Method Tutoring. And we're going to dig into the differences between the digital SAT, the old SAT, advantages, disadvantages, and also the ACT as well. So join us next week, and thank everybody so much, and look forward to seeing you on the next webinar. Thanks, everybody.
Thank you guys. It was a
everyone.
pleasure. Okay.
Bye.
Have a good one.
Thanks all.
Bye.
Mhm.